Hey everyone, Dr. Smith here again. Today I wanted to cover a really important topic to not only chiropractic care, but also upper cervical care especially. And that is a concept that we like to call holding an adjustment or holding the alignment of the spine. Now, it's a common misconception that people go to see a chiropractor to get adjusted. And while that may be true the first couple of visits, not every visit equals an adjustment. It's not a one-for-one trade-off there. I think it's often the assumption when you go to see a massage therapist that you get a massage, and so people think, oh, you go to see a chiropractor to get a treatment of some sort. But really what we're doing on each of those visits is checking to see whether or not you need to be adjusted. Now, you can think of this a little bit in terms of going to see an oncologist. Say you were unfortunately diagnosed with cancer. They found some sort of a growth. So they ran all those tests. They found out exactly where it's located, exactly what the size of that growth is. Then they do a treatment, whether that's radiation, chemotherapy, whether that's surgery to remove some of that tumor. And then they go back to check to see how effective that treatment was, right? But they don't just keep giving you drugs and keep cutting you open and keep doing all those things without any reason to. Right? And the goal is to eventually not have to do that anymore. And that's the same with chiropractic care. While it's good to get your spine checked, there is such a thing as too much of a good thing, meaning too many adjustments or too often getting that kind of a treatment when it's not needed, right? So the goal is to get you to a place where you're holding the corrections or the stabilizing adjustments that have been delivered up until this point, and you don't need to be adjusted, right? That's kind of a wonderful thing about upper cervical care, is that our goal is to get you to a point where you're stabilizing and you can go on and live your life and you don't need to see us as often, right? Now in the beginning it may be you only hold that correction for a few days or a few weeks, but as your body starts to get used to that new position and starts to find its new alignment, those holding periods can go on for months to years, right? Now, it's important to get checked on a couple of times a year, maybe once a month for some folks. But understand that if you come to our office and we don't have to adjust you, that's perfect. That's exactly where you should be, because it's during these holding periods that the tissues around the spine, the bones, the ligaments, the tendons, and the nerves are going to be healing and reinforcing that new position, right? Your body has this wonderful ability to heal. It's important as doctors for us to understand when we need to intervene, but also when we need to take a hands-off approach and just let the body do its thing, right? So I hope that made sense. If you have any questions about what holding is or what it means to have an adjustment stabilize, feel free to give us a call or send us an email. Otherwise, I look forward to seeing you next time. Take care.